Very good afternoon and welcome to the session on the topic Myths and Belief related to infertility. We are glad to have Dr. Vijayageetha pathangae among us today to help us understand the topic. The doctor will help us understand more about this in the details within the session today. If you have any doubts, any queries, post that on the comment section and our doctor will take that in the last of the session. So be there till the last. Stay tuned for getting all your queries solved. The doctor is here to help you guys. Doctor, you're most welcome and you have the stage now.
Thank you. Thank you for the introduction. Welcome, everyone. There's another session today on myths and belief. Um, can anybody relate or share something that you know or something that keeps you on the go stating that? Whether it is a myth or not, you do not know, but it is something that you would follow for your conception. Okay, even before that, let's have a small brief about what an infertility is all about, because the terminology is sometimes very least understood. So infertility is a condition where in a situation the couple is unable to conceive over a period of minimum 1 to 2 years, trying to conceive without any obstructions, means without any barricades as in the face of condoms or any other external factors. So the cause is not known, but despite carefully timed and unprotected intercourse, at least for a period of a year, still if the woman is not able to conceive, this terms to be infertility. Though there are many levels and many inadequacies that are related in this factor, it all comes to boil down with a few ones. In a female, the closely monitored one is an ovulation, and in a male, it's closely monitored with the semen analysis. These are the main two things initially to start with a treatment as such per se, or even to monitor. These are the minimum two criteria that is involved. So, though the main treatment is to increase the chances of getting pregnant, to go to the main treatment, we need to understand the hormones and the physiological functions. Since hormones is closely associated with behaviors and moods, and it also gets disturbed due to one's own lifestyle, which is closely, intervened, there are a lot of indicators that says that you need to have a right lifestyle, you need to have a right thinking, and then there is a planning. So to brief out a little bit, a couple who is, let's say, planning to or establish a family would be heading towards a consultant who's an expertise in infertility. So the monitoring though goes mostly predominantly for a female, which would be on a regular basis and would be on time to time. Medications are highly timely and time specific. And for a male, similarly, they are time specific, but they do carry some duration. And on an average, if you see, as minimum as a semen analysis or a DNA fragmentation index along with that would suffice to gauge the fertility aspect of a male. Whereas in a female, since most of the conception to the pregnancy and the delivery happens within this body, a lot of changes happens inside the womb, inside the hormones, inside the health per se. So since it's a very dicey, complex situation, and it is mostly subjected to the women, they undergo a lot of toils and turmoil. When it's not understood properly, it sometimes becomes like a trauma. So, in short, what an infertility is meaning? It is in general, it is not able to get pregnant after a year or longer of unprotected sex. The three main causes of infertility is, let's say the lady had a history of a, pregnancy, or the uterine lining is damaged or scarred during any surgeries. The fallopian tube is blocked or scarred, and the ovaries are affected due to some external trauma. There are also issues associated with that, can be cervical mucus issues. If the ovaries are carry cysts, which we commonly say as PCOD or PCOS, there can be presence of fibroids within the uterus, outside the uterus. Two major conditions among the endometrium is the endometriosis and the adenomyosis conditions. And also sometimes pelvic infection diseases and medications and drugs of other treatment can sometimes intervene the hormones. So these are few of the important factors that would have already started causing an intervention in the in the female's fertility aspect. And whatever is the treatment that has been given, all this sets to weigh down the factors of infertility more. So how would all this all sometimes supposed to happen? So despite of this 1 year of an engaging as a couple, there are external conditions, which what I said, medical conditions like an endometriosis or adenomyosis or uterine fibroid, thyroid, cystic ovaries can lead to added disadvantage or hampers the plan towards conception. So these are some of the things that we can brief out what would be the infertility and some of the important causes of infertility. Infertility is usually divided into two parts. One is a primary infertility, where the couple has just not become pregnant, the women specifically. And secondary infertility is able to become pregnant and then there is no, the pregnancy is not getting continued. So can be termed as secondary infertility. So uh, getting back to the myths part. So we briefed about what would be the infertility is all about. Have you come across or heard the term, yeah, specifically if you're a woman, that hey, you're getting older. You've been married for quite some years, right? When are you planning to have a family? And if it is for a male, it's like, come on, man, take some responsibility. So these are some important hashtags or a kind of a pressure dialogue that you would hear from your family members, from your friends, your colleagues, your surroundings, your environment. Or let's say you go attend some parties or functions of your near and dear ones, and they would be having this curiosity in their eye. You seem to be married, but what plan next? Well, then that is what strikes most of the people's mind, that excuse me, we are also trying, but we our roads are not able to meet where it has to go. So despite of whatever is the um, understanding based, the people would start educating them, like, no, do like this is how somebody would come to approach you. Hey, you know what, I was actually not conceiving for quite a few years, and then I did this, and then immediately I got conceived. So small tack stories like this, which is like birds whispering, and that catches a lot of attention, and then a person would start blindly following them, not realizing will it lead to her issue or not. So some of the myths is what we are going to deal here. The first myth itself, it says that, oh, this is all women's fault. Lady, you get prepared. You need to go to the doctor. You need to address all the issues. You need to put your hormones on straight. You need to reduce weight. You need to put on weight. You need to eat this. You need to be like this. And the queue goes on. So the need to adds on as a psychological barrier in future. Is like, oh, this lady, I'm not at all going to meet her. So the myth here is like all these are just added stress. You need not do anything. All that you need to go is to validate yourself. What is your fertility platform? The right consultant. This is where your hormones and your physiological conditions would be gauged, and they give you a right picture. Let's say you want to postpone your parenthood for quite some time because your job is in an establishing phase, or your family work, let's say there is a project of constructing a house, is in establishing phase, whereas a couple you do not find time to invest to build in a family. The doctor would be here, the right person to gauge you, to give you, this is an appropriate time, this is where you have to act. But based on your reports, this is where the clock would tick. These are the pros and these are the cons. We will gradually come to an understanding what are the pros and the cons, but at least you will get a tentative understanding where in your fertility basis you are standing. and that helps you to decide, can I postpone my parenthood, or do I need to take up my motherhood as soon as possible? So most commonly done treatment would be, the doctor might put you on a medication, she might track your ovulation, and she can come up with a planned treatment of instructions. This is how a natural conception is monitored, gauged, and mildly supported with medications. So the myth, which is also about the age, what are the other things that one would relate when the moment age comes to the picture? Your mother would say, I delivered you when I was 15 years old. You're 35 years old and you're still planning for it. So that is a horrifying dream. Or your aunt could say that I got my first baby when I was 22 years, but you're still not conceived. So it doesn't mean that you've crossed off the window. It is all that your hormones that matters. So some relevant hormones, those are very important to gauge your fertility bed. Your doctor would speak with you based on your fertility background. So this requires as minimum as a scan, which is an ultrasound transvaginal scan. Along with that, a blood test which says that, hey, this is what appears in the scan and this is what your blood says. So these are the, let's say they are going hand in hand. Congratulations. You can always postpone, plan accordingly, or take a break and come back. You people have a lot of window time. Your AMH also plays a very important role. It speaks about the ovarian reserve, and let's say it is more in the fertile area. The doctor can say that, okay, you can take a break, or do achieve what you wanted to achieve and come back, but not prolongate it. So this can be a rightful advice given from a doctor to say, hey, everything is taken care, so we can do other things and get back to us. So what if the other way the picture is wrong? If the AMH value is compromising, if a FSH value is too high or a LH value is too high, and they are always constantly fluctuating from, with a greater differences, what if your hormones don't come within the normal range of existence? Sometimes you're shedding, which is your periodical phase time. If the shedding of the blood is inappropriate, incorrect, not happening, what would you like to do at that time? Do you need to manage? And I say, no, this is just my body, I can ignore it. Never take a self conclusion. So planning for your family in whatever safe manner is possible, involving a doctor here is a very important factor. So, according to some research documents, where some of the researches was done in the area, from around the period around 2009, which is starting up, the myth that is first that got documented, which was among an Israel population, is more of age related. So they said that as the age increases, the fertility line decreases, and then also that research paved way to say that late pregnancies in the era with the assistance of an assisted reproduction led to the increased complications of other pregnancy issues. Though the result does not talk about what were the other complications, but the pregnancy, the delivery aspect, whether it's going to be a normal delivery or C-section, the success of the pregnancies and postmenopausal pregnancies, they were all having its own complication. So it did say that women who had chances of spontaneous pregnancy in the younger age, when compared to women whose chances of achieving a live pregnancy after an age of like 40 plus or above, both the success rates in the late or post-menopausal period pregnancy were actually overestimated. And if we see, there is a difference of around 11 percentage. So which means to say that it is good, and this research paper not only paved in light to many other important factors, they also paved a light on what happens to the oocytes, quality of the eggs retrieved after the 40 plus aged women, where there can be achieving a good quality embryo. Though it is a complex paper, there were four perspectives that were seen and demonstrated that the among the Israeli population, age becomes a very important factor, because beyond the 35 years barrier, the late genetic motherhood motherhood has a drawback owing to the quality of the cells, the quality of the pregnancy journey, and the quality in the delivery. And however, it is important to increase the awareness to say that these are all the possibilities that a woman will have to face if she is happening to postpone or procrastinate the planning of pregnancy after 40, and what are the individual impact behind them. So, with related to age, this research paper will not only talk about oocyte quality and other, but let's say if the hormonal factors, your AMH, your diet, your lifestyle, all seem to be very good, and for some personal reason, let's say you've been married only at the age of 40, 42, can you still achieve a pregnancy? Yes. Why? Because through your quality lifestyle and your basic physic responses, you were able to take care of your fertility health to a great extent. So this is what is the impact of the research paper which was published in the year 2011 talks about. Also, there is a lot of myth regarding the knowledge, the perception towards an IVF. Many think that, madam, is it an artificial? Madam, will the baby will be the same as other baby? Obviously, this is not artificial. We are not doing something artificial. It is called assisted reproductive technology, not artificial reproductive technology. So, what do you mean by assisted? We said, I spoke during the beginning of the session that if a lady wants to conceive, she will be visiting the doctor, and the doctor would say, things that would help her to understand, plan, and decide when to establish a family. What did the doctor do here? Or what did the consultant has done to the lady? She has assisted with knowledge, which is the first level, with the help of the lady's scan and blood test report, showing her the picture stating, hey, on fertility health aspect wise, you are at this phase. So, around the lane of 5-10 years, what will happen to your fertility platform? Do they decrease drastically, or do they maintain in the same level, or will they decrease this regularly on regular basis or slowly decreasing? So once you get this picture, you will have a clear cut understanding that, okay, I still have time, I need not rush for my pregnancy. So age, as Wright said, is the most and first important factors, because in a current society or a current generation, women are also equally goal oriented, target oriented, task oriented, and have a lot of work oriented focused set. So to achieve their goals and to achieve their dreams, it should not be like a force of an age, because of the age which all matters. It is like pulling the lady in achieving her dream. So some of the other myths and facts about is regarding the embryo transfer. So many do not understand what an embryo transfer is all about. The gametes, which are healthily cultivated outside the womb, is assisting through the embryoscope. What do you mean by assisted? The embryologist might induce the put the sperm inside the oocyte, and then say that she's done the ICSI procedure, and gradually monitoring the cell development under the embryoscope. So these are all assisting in creating many healthy embryos as possible. So what are some of the factors and steps that would come here is that, what are the adjustments that one needs to undergo before, during, and after if you are looking for a help like this? Obviously, there is a lot of adjustment that a lady would have to do, because it is she that she has to face for the treatments. Predominantly, not only the conception but also delivery falls into her responsibility. So for her, the time, the life, the job, everything has to be well planned appropriately. So she has to adjust on so many factors. So after an understanding, this is the my health platform, this is my emotional quotient towards that, why it is not supporting, because there's so much of information that you have not had the right understanding. So let's say in your health setup that there is a health psychologist who will help you to explain where actually you are standing in your fertility health. Doctor has given you, for this you do this, for use you do this, for use you do like this. Though the guidance is there, where is the understanding for that knowledge? So let's say you have seeked or got those understanding of the knowledge, and then you're trying to achieve the same. So there's a lot of mental adjustment, planning, and also there's a lot of emotional adjustment that a lady would be subjected and undergoing during her fertility phase for the sake of conception. Coping usually is a very good example. Why? Because there's a lot of adjustment that goes. Who likes adjusting when already there is a routine in a lifestyle that has to be followed to move forward? One or two disturbances is all okay to say, but what about an everyday disturbance? Every task is a disturbance. Every achieving point becomes a tasky. So gradually the person would develop frustration. So the emotions as such are erratic, and they tend to become, highly intense due to the elevation of the hormones. So what would others say? Oh, she has hormonal disorder, so there is a mood swing. It is not this way. The hormones are too high. It also complements to the mood distraction which is already being done, and it aggravates a little bit more. So this is how we would like to see. Other important part in the myth is that of the informed consent. So there's something called consents that is being, getting you signed to say that this is a treatment, these are the steps that you would undergo, these are the things that you would be exposed to, or you're forced to face this, and you would be undergoing all this. So the consent says all about what an IVF is, what you would be subjected up to, and what can expect out of you. And there is no blame game here. Let's say the implantation failed or the pregnancy did not happen. The couple immediately becomes, very curious to know, start and understand the curiosity, but they'll start trying to probe what went wrong, what went wrong. Oh, okay, no, this is because of that. Oh, that is because of the nursing stuff. Oh, this is because of this person who yelled and shouted at me. So I should have been very calm, and she did not allow me to do so. It is not like this. Emotions are erratic, but nowhere it says that just because, aggressive emotions, those sometimes can be hazardous. So getting into the age, we will look into what are the other factors. The second one is poor nutrition. Haven't you noticed that, let's say, post marriage, people or your in-laws or your mother would be expecting, eat this, eat that, eat like this, eat like that. Oh my God, too many inclusions, too many people poking their opinions on you, too many guidance, or too many unnecessary what do you say, there's no privacy in your food aspect, where there's constantly someone to keep on picking on you to say this is the right way. If you do this, you are obstructing your child growth. Because of this only you're not getting pregnant. So these are all some of the factors that is associated with food to say that, sometimes does impact however, currently there is no direct research paper to say that by eating this food or eating these things or by being in this way has caused my less or lack of infertility in the person's life. There is no direct paper. However, erratic lifestyles and erratic mood disorders can have its impact on the fertility aspect of the person. Smoking is fine. Is smoking fine? And we say that everything is good as long as I hold it in my limits. No, the smoking or the drinking aspect has its own impact and gets root down to many different internal organ issues, out of which fertility is also and one of the issue. So what happens with the aspect of drinking and smoking here is that it can affect your hormones, Then there is an hormonal fluctuation. Because there is a fluctuation and there is no nutrients in the blood, these two combine to say that the ovaries, which is supposed to produce one dominant follicle, and the egg is supposed to grow in that environment, since the blood is not having a well nourishment, the egg that is supposed to grow develops into a unhealthy cell, and thereby the lady loses all her chances of conception for that month. Unknowingly, or by nature itself, women is made to produce only one egg, just one egg. So, if there's anything goes wrong, one, we cannot see. Two, there is no direct treatment. Three, the lady has to wait for another month or two to again see one more follicle grows, another egg comes out, and then we have to check. There is no powerful microscope to directly look into the egg and say, hey, your eggs are growing fine. All that we are documenting here is nothing but the follicular documentation, which clearly shows how many eggs or follicles are growing within an ovary, and how many eggs do you expect within one follicle? At the least of one. So there are many ways to gauge and look into the follicular aspect and the health aspect of the female to say. So smoking has nicotine, and it is a direct cause for one of the reasons for affecting the fertility of the couple. So does then passive smoking also creates an impact? To a certain extent, the research papers do diverge, stating that passive smoking also causes harmful hazards on people who are standing next to them for breathing fresh air. What else is there? IVF is painful. IVF is never a painful, though the process of getting yourself stimulated sometimes can have injections. The injections are sometimes to be told to be done on a daily basis, and not but one, but at least a few injections that needs to be put. So the tolerance towards the pain or the pricking sensation, a lady has to inbuilt or built it within until she starts with the treatment, so that the medications can be taken up with ease and she feels less stress. So according to another research paper, the the reproductive part itself, this is nowhere artificial. The eggs are retrieved from the women, the sperm is also retrieved from a male, the embryos are done, the fusing part or the ICSI part is done in an outside laboratory system, where is the humans interaction, which is through the hands, the ICSI is being done, after which the most important part is the embryo growth. They still tend to be natural. So fertility itself has many steps, and not all the step has to be what do you say, to be just man driven. It sometimes there are some automated steps that will just happen in an IVF, and the couple can just eagerly wait to do so. So next, apart from what we call the what foods affect fertility. So just like in the beginning of the session, which I had told you, that eat this, don't eat that, your neighbors, your mothers, your grandparents, your relatives, um, whoever is walking through your life, and they happen to notice that because they have all attended your marriage or know when you got married, they would start directly or indirectly hinting, hey, eat this halfaya, this would be really very nice, eat this moong dal, this is protein, this is very good for your bones and pregnancy. So all the foods, or your Diwali sweets or your New Year sweets or your Christmas sweets that starts coming in will gradually come with an indicating stating that eat this, it is good for your reproductive health. So is this really very true? What are we actually missing here? Food indeed is the most important aspect where a human body would find its immediate nourishment. So for the body to survive, body needs nutrients. So where is the immediate dependency of the nutrients? Food, right? So it is actually what you eat and what you drink is the first carrier of all the health. Only when what you eat and when what you drink is not at all sufficient, is not at all satisfying your need, and there is still deficiency is existing, then one has to look into other artificial food. So food is the only way or only source that the human is dependent upon to get the nutrients. It's nothing but food. Can we relate to some of the foods that is really very beneficial? So let's say a lady is planning for her pregnancy and she's anemic. Initially, during the planning for the pregnancy, let's say she got her periods today. So from today for the next 4 days, she would be having heavy bleeding. And ideal, on an average of 60% of the female, when asked the eating patterns during or when inquired during their eating patterns, they would say that we don't feel like eating. So this plays a very important line that says that most of the ladies shun eating during their pregnancy time. So what happens? Lack of nutrition, lack of blood health, and lack of fertility health, which is nothing but a chain reaction. So this is what the foods affecting about the fertility is all about. So what else we see? Why does it mean by food, and what are the foods? So let's say towards a good ovarian multiplication, one needs to have a lot of vitamin B12, B1, the I think omega 3 fatty acids, and then B12 cyanocobalamin, which is the neurofunctional. What else do we carry for a good IVF success rate? What are the some of the blood tests? You can check your nutritional deficiencies. You can check for your other parameters of the internal organs to check that all are fine. We don't need just the uterus for reproduction, right? So the nutrition or the other mechanisms of doctor like a gastroendocrinologist or let's say a pediatrician, if you have joint issues, would sit and work up with you to say, hey, you or this body is planning to take up pregnancy, so you need to bulk up with these nutrition so that when you are crossing this threshold of weight, your transition is very smooth. So fertility, oh yeah, infertility, foods is the first resource where any human would look into his. Caffeine inhibits your pregnancy odds. To a certain extent, yes. Caffeine, as such, has a lot of beneficiary actions. What are they? They tend to keep the person alive. They tend to uh, 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 increase the stamina. They tend to increase the focus. Among gym goers, people tend to have caffeine to build in that endurance, and they also see that it keeps them highly mentally alert. Okay, when all these things are there, why do you need to think? Why do you need to first point to take it? Right. So it is known according to the research work that caffeine is not so important and not necessary. Nothing is to be of a harm if you take 100 ml per day, but it should not be on a regular basis. So, because caffeine or coffee has inhibitory properties of pregnancy hormone. So, when your body is struggling to produce more, and then I intervene, hey, time is done. Let's take a blood sample and let's see what is the answer. And then we see that okay. So the negative. Why negative? Because, and then we would ask, and what else can be done? You can come for the second cycle, and so on. So food, your intake, specifically caffeine, plays an important role in quitting them. Stress reduces fertility or stress causes infertility. What is your opinion on that? Does stress reduce infertility, or does stress causes fertility? So, okay, let me continue. Stress is a psychological factor or a phenomenon which says that these things of questions which is running in my head, I have not concluded with an answer. So the point keeps running in the back head. What am I supposed to do to get out of this, a fan which is very old? What am I supposed to do? What am I supposed to do? Until or unless you would go to a neighborhood house to see what she has done with that. Right. So when you see what she has done with that fan or the stand, she would come and try to manipulate or remake it or reassemble it or do something to do that. So these stresses have an answer. What about stresses that do not cause an answer? And the consultant or the doctor would say, "Excuse me, sir, we have done our level best. Kindly wait till you get your batch time free to have a word with the psychologist as well as the counselor. I mean the consultant." So the first and primary part of any consultant would be is to reduce the stress by reducing the anxiety or the worry behind that. So when the lady starts speaking about, "Ma'am, I don't know, I'm worried, I just want a baby, this and all seems to be too much of to me, and I'm not understanding anything," need not worry. You need not understand anything. So the point here is to move forward with what you have, and then gradually you will see things will also fall into their place. Now, this becomes very important. So apart from that, just like how smoking cannot be intervened, so is your booze, which is your alcohol booze, and they definitely obstruct a great chances of pregnancy. So that's why if you go to near pubs and bars, you would see that night drinking is not allowed for women. Right? So, have we noticed that in the life or somewhere within us, our friends, our colleagues have already shown us an impact of what alcohol is all about? We can also take an initiative to say, "Hey, you don't do that." Now, this becomes a very important factor. A little toe can't hurt. Man, eating little is not going to be bad. Eating little more rice is not never going to be worse. Eating a little more is not going to do anything good. Is that true? No. So the point here is, since everything is sorry about the presentation part. So what I am saying is, little thing is not going to be of a big deal, but yes, but do give time for the body to believe. What are some of the myths that we see? Age is a myth. You're not supposed to uh, you will not get pregnant if you are trying to plan your pregnancy after 35. Using of a birth control pill can cause infertility. These are some in the females. The males, which chronically we would hear is, "Ma'am, is it okay? Tomorrow is Tuesday. I cannot give my sample. Can I give it on Friday?" We were like, "Oh my God, already there's Tuesday, Wednesday, Thursday is all gone." Okay, then Friday. Then he says, "Ma'am, I have tried to maximum manage and my abstinence is 15 days." I mean, it's like, excuse me, this is not the right way to do. So for every test has a particular way pattern to deal and give with it. Only then you can achieve a good test results. So according to the male semen parameters, healthy sperm can be seen in an ejaculate in a 3 to 4 days of abstinence. So this helps us to give you a good report, and we can also avoid too many dead sperms in the ejaculate. Something that we would like to look into, um, the causes for the infertility is very specifically is an age, smoking, histories of miscarriage, weight gainings, and sexual histories, alcohol, bad food habits, bad drinking habits, bad sleeping habits. So these are all some of the myths that causes infertility specifically among females. So let's look at the infertility specific among males. Nothing wrong with the prescription drugs, though. Haven't you noticed that for any couple who is getting planned for pregnancy would have this huge prescription? This medication also has the same medicine. This medication also same has medicine. This medication also same has medicine. But then why is doctor writing us 3 or 4 different ways? Though the target of hormones is, progesterone and endometrium and all these hormones that comes to the picture, we have to see that they are properly mingled with the blood, and properly the medications are utilized by the body. So medications here which is prescribed is very important. They have a lot of hormonal and physiological impact. That is why it is said that nothing is wrong with prescribing the drugs, though. But be on the same page where your consultant was also talking to you. So this is the most important behavior for any person who doesn't even want to feel to come and talk, or give us an understanding and all that. Rather than that, everything else comes to the picture. Your overall health doesn't impact fertility. This is again wrong. You can be um, the age of 21 to 23, and there are lots of evidence which says that the blood groups done by the female varies in their numbers. Though you are in your early 20s or early 30s, the number of the follicles that can be retrieved, it will be definitely less for these ladies who are trying to conceive natural, when compared to ladies who are taking for the infertility treatment. So your overall health does not impact is not a very good terminology to take. Be mindful in whatever you are eating and doing for. Food that's going to cause you dehydration, foods that causing you constipation, foods that are going to cause you to take up great deal of pressure to take up to say, hey, this is not at all fair. So you have to be very important on all of these aspects so that it does not impact your fertility grounds. Infertility is typically the women's fault. Female doesn't matter as long as you are under 35. No. Since the documentation has not happened for those young ladies, because they will say very clearly, what is wrong with me? Why do you want me to undergo a blood test? If these are all the factors that she is coming to talk about with it, then you will see or notice that uh, the women age and the fertility aspects never matches. There are women who are as thin as possible, as healthy and good looking as possible, whereas when we do certain blood tests, the relevant blood tests, the markers are always beyond the range of expectation. Whereas younger aged women, younger what do you call, younger females who are married but at the same time who wanted to postpone the pregnancy see a fruitful result. So it is actually not a women's fault. Female, no matter how long or what, since age plays an important role, see that you finish your pregnancy or motherhood even before that. The most important um, aspect here is the misconceptions of ejaculate. Most of the female would accept or forced to accept that there's no problem with my partner, but the problem is completely with me. This is a highly negotiable, highly detail oriented question. You cannot give a one line answer for this. Why? It is because male parameters like your semen angiogram or what we call the DNA fragmentation index all paves a path to check on the male quality or the male parameters in detail. They too have blood tests which are topically based on hormones, and they too can gauge the fertility line. And are they having any chances to improve them? Yes. So the psychologist there will give them the help to how to take care of the male health. How are we supposed to take care of them? How important it is to take care of a male health? Because we all thought that if a male is able to give a sample or an ejaculate, we've always seen that, hey, there is sperm here. Failure to see what is within the ejaculate. So it is in a male that the fertility aspect is more dependent upon the semen quality and the hormonal profile. The fertility aspect for the female also remains to be the same. Here it is going to be the egg quality and the fertility aspect of the egg quality. Since the fertility of aspect of the egg quality or the sperm quality is the same parameter which is seen for both, each plays to be a very important role. Role of the quality of the cells given also plays an important role. Infertility is usually female. Male has got nothing to do. Why? Periods, periodical cycle, your menstrual cycle also plays a crucial role. Gone the days where only periods used to be like 25 days, 24 days, and all of a sudden you would see that they stopping off clearly indicates that there can be more than one factors that is affecting the infertility. So it is not only a female issue. Why? Because the presence of uterus is only in a female human body, and if the cycle is irregular, then the fertility can be regulated. Okay, so you need not worry that the what do you call the aspects of fertility when you gauge, that needs to be kept in mind very importantly. Your number of periods, very specifically this is for women, to see how your periodical dates fall. Are you having a 25 days, 28 days, 30 days? But repeatedly it should go around that. And also for men, try to do semen analysis once in 3 months with just a 3 to max 4 days of abstinence to gauge your fertility parameters. Couple should always try for at least a year before seeing an obstetrics. I don't think so. No. In fact, what I told you, or reiterating you right from the beginning, is if you want to plan, even if you want to postpone, speak with the doctor. Let her gauge your current condition, your current hormonal assay, your current shedding, your current ovulation, your current ovulatory fertility period. All this assessment, and a doctor would help you to give where you stand. With that report, any women can sit, plan, and do things accordingly. Is infertility is always fixable? No. Infertility is never fixable. There is always a solution for the problem that is coming in. The only reason why infertility becomes highly expensive is because, on an average, there is no treatment to treat the cells of the person. What do you mean by the treatment of the cells? Now, let's say every time the growth hormone is given, eggs are developed within the ovaries, and then only when we retrieve, we would come to know what is the quality of eggs, whether even eggs inside, even if whether what the quality is. Just like how we collect a semen sample from a male. Does the ejaculate have normal sperms? Does the ejaculate have progressive sperms? Does the ejaculate have sluggish motile sperms? Does the ejaculate have immotile sperms? Does the ejaculate have dead sperms? So these things are very important to be documented. We do have medications to see that these small hurdles can be rectified. Then why is doctor suggesting IVF? If doctor is suggesting IVF, then you need to mentally conclude that your condition can only be managed. You cannot treat your condition completely and you start conceiving naturally. Now, this is where your doctors would help you in understanding where you are and what are your parameters, and based on which, what is your fertility foundation. Now, what do you do next? You can do one thing. You can Google search for Apollo CM Fertility, take an appointment and meet us. Not time much. Then you can make a note of my number and you can seek for some psychological understandings. Because every fertility or infertility case is on case to case basis, and the treatment line, procedure, protocol all varies. It is also based on the person. Oh, ma'am, then what are the procedures and what are the protocols that you would go through for a couple to conceive? We monitor natural conception. So, the monitor here is to see that the lady is ovulating, and with a little bit of help of a scan or something, the doctor would plan for the fertile window and then send them. So the couple would know what they're supposed to do, and then they would come back with the beta HCG blood test report. This is one way of doing. Let's say this is not taking a person fruitful answers, which is ideally to get pregnant, right? So the second step here would be you will be called on a day two. You would be asked to subject for the scan, check how the endometrium shedding and all is happening, because we do know that you are bleeding on your second day of your periods. Then see that whether a mild medication support is required, looking at the hormonal picture. And then she's given a medicine, and then the same follicular monitoring. And then we would see once the egg to be ruptured, mandatory to rupture, there is medication given, and then we send the couple home. So this is planned intervention. It is a natural way, but it has been properly pin to point planned. Third way of doing it. Since nothing is happening, we would do semen analysis, process the semen sample, filter out the good, normal, active, motile sperms, reduce the concentration, and try to lodge it inside the uterus. What am I talking? I am explaining about the intrauterine insemination, which is IUI. So you can attempt this a one or two times. Now, despite of all this, if you are not able to conceive, it is high period that you can switch to an IVF treatment. Why? Because this is the only platform where we get to see those eggs after retrieving out of the oocyte, and then there is lot of answers that can hit. Oh, probably then this cycle, the previous cycle, why the IUI did not happen is because can be something called a bad batch of an egg, or can be an impaired egg, or can be an immature egg, or it can be a dead egg. It can be anything. So we do not know that. Apart from that, the monitoring aspect would go ahead. If the IUI fails, then obviously the couple would be taken to IVF, because too many procrastination. Sometimes IVF also doesn't be beneficial. So this is where IVF comes to the picture, and the journey has to move on. Move along. Without which it is very difficult to look into the subjective development. So where does one start believing? Believe, do I have a hope that I can still plan for a pregnancy? Can I still have the hope stating that I can still be mother? Oh my God, there's a lot of medically assisting techniques that has been fruitful. It has brought, it was kind of a blessing to couple who just needed that small push, that little assessment, that small communication of hope, all had brought together in establishing what a couple wanted to establish. So actually, though the treatment is very simple, the psychological identification of oneself through those terminology of the term infertility has taken a psychological toll, and one of the most important factor that affects the couple. Okay, I don't want to go out, I don't want to meet my friend. If I go to temple, she will ask. If I go to picnic, she would ask. So there's lot of subconscious stress involved by a belief system that psychologically analyzes them to say, hey, if you go, this would be question, isolate yourself. The couple are pushed to a greater stress just because of that generated feelings of emptiness, despair, and sometimes disgrace. So the psychoanalytic theory, which was proposed among these infertility couple by Oshanki, says that it is not necessary to be female. Even male always have assumed that the personality itself has a deficient identity. The identity is so close to that. If I achieve this, then I am a very good person. I am not achieving this probably because I'm not a so good person. Probably this I'm not able to do because I'm this kind of a person. It leads to a lot of self-generated thoughts that create a lot of barriers, artificial walls that creates between people. So isolation, emptiness, self-inculcated thoughts of sometimes a trauma can happen, sometimes they can go to depression and many other things. The stigma is still existing, and the feeling of the shame and the secrecy still continues. So there's a lot of work expected from the researchers in the current situation to see how to overcome and contribute towards the fertility or fertility related aspects among the infertility or the fertility treatment seeking population. So with this, I would like to end my small talk on the myths and belief. Hope it has addressed what one would be actually, forced to believe, or would have thought that, oh, I thought, these are all the factors that would come. These are all the self-concocted. No, these are all self-generated thoughts. I did not know. I thought that she is thinking about me like this. So it is great deal that it has broken some ice walls within you so that you can bloom in a much better person. For any medical related queries or doubts, your psychological assessments, you can always walk into a Colosseum Fertility. We are always there to help you to cater what you want to achieve, how you want to achieve, very specifically, to the dreams come true. Thank you. Any questions, you can always post it. Okay, I have a question. Can I conceive with one tube, as my right fallopian tube is damaged due to hydrosalpinx, which was disconnected through laparoscopy? Left tube is patent and normal. Very good. Yes, you can still conceive, though the chances of conception is half. So your doctor consultant of your treatment, wherever you would go, would always monitor your ovulation, and all that you need to do is, when you are ovulating on the left side. So your ovulation happens on an average on alternative months and alternative sides. So you can still take a great chance and get back to your treating consultant, though the chances are less, but yes, you still have chances to conceive. So happy journey with that. Any further questions? Okay. So thank you for listening. Let's meet again with another interesting topic. Until then, bye.